All right, my friends, today is day number 33. Day number 33. Today is the 33rd day of the rest of your life. So today we're going to start to shift gears a little bit, and we are cooking it. We are killing it. Everybody is kicking it. We are Klondiking it. But now I want to start turning your attention to what you will do following the 42-day boot camp. And so what you should start thinking about at this point is how you are going to keep this momentum going, how you are going to keep up the pace, how we are going to keep pushing this car uphill, because as I've told you over and over and over again, exercising or any lifestyle change is like pushing a car uphill. As soon as you stop pushing, the car starts rolling downhill, and we are not going to allow that to happen. Okay, you will have our support continuously. You will have our continued support as we move forward. But think about it. Think about what we've been able to accomplish so far in 33, soon to be 42 days, and these benefits will continue to deepen as long as you continue to deepen your commitment to the program and your commitment to yourself. Okay, day 33. Have an awesome one, my friends. This is day 33. Have a great one. Bye-bye. Alrighty. So today's question of the day comes to us from Matey Joe. All right, so today's question is, I have heard several explanations regarding end-stage emphysema. Can you please explain what is happening and what to expect at this stage? Okay, so this is a very complex question. And I think I think the question has been made more complex than it has to be by so many people kind of contributing opinions on this, and this sort of, vague, variable, opined state of what is end-stage emphysema. So let me just tell you how I think of it. So by definition, the end stage of a disease really kind of points to a time where medical management and medical care has sort of run out of options, and where, people start to think that the end may be near, or they start to think about hospice care, or they start to think about palliative care. And it can be kind of a very daunting and moving and earth-shattering and shaking and upsetting and unnerving type of diagnosis when somebody says to you, hey, you have end-stage anything, okay? I will tell you my experience with it and the way that I think about it. So first and foremost, not first and foremost, but very often I will hear people ask questions about stages of COPD. And as you may or may not know, there's something called the GOLD classification, okay? And the GOLD classification used to pretty much grade people based on pulmonary function test alone, and now it is a more comprehensive grading scale based upon pulmonary function amongst other factors, quality of life and symptom burden, okay? Now, even with that, okay, I urge you to kind of put things in perspective, as I always do, but let me just say this, okay? When this topic comes up and people start talking about what stage are you at, I hear people say like, oh, stage is just a number, it doesn't matter, everybody's different. Or, oh, FEV1 is just a number, it doesn't matter, everybody's different. Don't pay attention to the numbers, okay? And whereas I think that has kind of become a buzz term, where people are like, oh, don't pay attention to the numbers don't mean anything. Well, in my opinion, if the numbers didn't mean anything, then they probably wouldn't be recorded, and they probably wouldn't be used for staging of a serious disease, okay? But what I think gets missed very, very often, not just by patients, but by clinicians as well, is the fact that your numbers are often divergent with your level of function and with the way that you feel. And so what I mean by that is that I've seen people who generally have okay pulmonary function tests that might indicate that they have mild COPD or mild lung disease. Yet their symptom burden is so great that they take on a functional level that is much lower than their COPD classification. Okay, so what do I mean by that? I say over and over again that breathing is a multifactorial process. And why I say that is to kind of take into account all of the different factors that can contribute to making you breathe better or make you breathe worse. So are there people who maybe are only diagnosed with mild COPD as based on the GOLD guidelines, yet have a symptom burden that's much greater because they're inactive and out of shape, because they're 50 pounds overweight, or because they had a massive myocardial infarction 5 years ago that left them with congestive heart failure? Absolutely. And likewise, are there people who, according to pulmonary function tests, have severe COPD or severe lung disease that still function very, very well as every variation in between? So we could have poor function, like poor lung function results, good physical function in everyday life. So there's a mismatch. We could have good physical, we could have good COPD numbers on pulmonary function, and we could have a poor result. So somebody who's more limited than their PFTs might indicate. And then there's more appropriate, kind of matchups where I think most people fall. But as opposed to the people who say, oh, number is just a number, or stage is just a number, like that doesn't make sense either. So the way that I think about it is I try to take as many factors into account, like pulmonary function. So we might look at FEV1, we might look at the ratio of FEV1 to FVC, but also at the same time, I'll look at heart rate and rhythm, I'll look at blood pressure, I'll look at oxygen saturation, I'll look at stress testing, exercise testing results. And then I'll take all that data and I'll put it in one hand, and then with my other hand, I'll say to the patient, well, how do you feel? Okay? Because every time this question comes up, you hear stories from people who say, I've been diagnosed with end-stage COPD for 10 years and I'm still here. Or you hear people who have very, very mild COPD, yet who have become respiratory, compromised individuals because they get short of breath and their anxiety kicks in, and their airway irritability kicks in, and so on and so forth. So my recommendations surrounding this issue would always be as follows. Number one, collect as much information as you can, okay? Is it great to find out that you've been diagnosed with end-stage COPD? Of course not, okay? But at least you have information. At least you know where you stand, which in my opinion is more valuable than burying your head in the sand or taking a dip in that famous African river, denial. That's my old boss, Dr. Pineda. But anyway, the point is, you have the information. Do you let it rule your life? Absolutely not. So if you feel like you're doing pretty well and then you find out, hey, I thought I had mild COPD, but instead I have moderate or severe COPD, do you say to yourself, hey, I'm supposed to be much more short of breath, and then decline? Absolutely not, okay? Everybody must be treated as an individual based upon all the factors. I'm not disputing the value of a pulmonary function test, but it is one number of many numbers. It is one value of many values, and it does not correlate one-to-one with people's functional ability. That is their ability to get in and out of bed, their ability to get up from a chair or get on and off the toilet, their ability to take a shower, their ability to go out in the street and walk. Now, are there some people who it correlates in? Of course. Again, if the numbers didn't at least partially add up or correlate, then they wouldn't be used, right? They would simply be considered arbitrary. But the thing is, I don't want you to get tied down to the numbers. And, to me, in my opinion, when somebody says somebody's end stage, or when somebody says how long somebody has to live, and I've said this before, I think they do that person a very big disservice, okay? And again, is it helpful to know, hey, I have 6 months to go, I better get my affairs in order, or hey, I have 6 months to go, I better, do the things that I want to do, I better start, checking off items on my bucket list. But, in more cases than not, what I find is that it is very effective at vanquishing hope and smoking out hope. And to me, it's a huge disservice to your patient to take away their hope. And, what I say to people is, when they go to a doctor and the doctor says something like, there's nothing more I can do for you, or you're only going to get worse and then you're going to die, or, my hands are tied, then I thank the doctor for that information and I leave to find another doctor, because I don't want a doctor whose hands are tied or who feels like they've done everything they can or doesn't have any more tricks up their sleeve. I want the doctor who is going to keep fighting alongside with me for as long as I have. Sometimes people go before, the number, but the thing is, I don't like it when people are given a date. Several years ago, I had a wire hair fox terrier named Phoebe. I tell this story often also. She had bladder cancer, and the veterinary oncologist said to me that she had about 3 months to live. Okay, horrifying news. And the thing is that Phoebe lived 3 more years, right? And so my point is that people don't always know. My bet is that they more often than not are making an estimated, educated guess, which I don't want to hear. I don't like being given bad news by people. I don't want somebody's opinion if it's not a positive one. I don't want somebody to highlight my limitations or tell me what I can't do. And maybe that's part of me being in denial. And, growing up, my parents used to say I was like Pollyanna. But the idea is that I don't want somebody to break my stride, okay? I want to keep on moving as long as I can. And if you have the idea that you think that I should have done something different, or I could do it better, or I didn't do a good job, or this and that. Not that I'm not open to constructive criticism or feedback, but you know what? I'm generally somebody who doesn't appreciate naysayers. And so when this doctor, told me about my dog, like I said, I found another doctor. I found a holistic doctor in New Jersey. And I love that dog because 2 or 3 times a week I was traveling from Manhattan to New Jersey to see a veterinarian. And my dog lived for 3 more years. But I will be damned if every day for those 3 years I didn't think about the final day with my dog, because of what that doctor callously told me in a kind of flippant way, because he's an oncologist. And he said, you have 3 months to go. So for 3 years, excuse me. So for 3 years, I worried about it every day. And my dog lived for 3 more years. And I think that, again, when you tell people similar things, now granted, everybody's different. Some people may say, hey, give me the straight dope. But some things are not black and white. Some things are not predictable. Some things don't go the way they should, either positively or negatively. So for me, my feeling is, you know what? I run until I hear the whistle blow, okay? Or like Jay-Z says, when the director yells cut, right? So I'm gonna act this out until the director yells cut, at which point I'll be fine and I will know that I left it all on the playing field. I'm gonna keep my legs spinning until I hear the final whistle. I'm gonna keep punching until I hear the final bell. And that is what I encourage you to do. Too often we get caught up in the classification of things and the nerdification and the scientification of things. And you know what? People have ways of kind of overcoming and overriding and you know, just people have a way of surpassing things when the spirit is right. And when the mood strikes and when the spirit is hot and when people have the will to live and the will to excel, they have ways of passing things and surpassing things. And granted, there are times where people fall short of expectations, okay? But again, you know, I get that diagnosis, I'm fighting harder. I'm not getting ready to pack it in, okay? So again, end stage, I think it's a horrible thing. It's a horrible name, okay? It sounds horrific. It's like congestive heart failure. It sounds horrific, right? It sounds, in my opinion, worse than it is, and it sounds like there's absolutely nothing else to be done, as does end stage lung disease. But I believe in treating and fighting and striving and pushing and supporting health and wellness until the very last breath has been taken and until the end has been proven. And that's my philosophy, okay? It's okay to know your numbers, okay? But I often hear patients intellectualizing or philosophizing about things that are really above their heads. And, you know, it takes the focus away. I talk about balance and I talk about focus, and, you know, focusing on things that you can't change or you don't really understand or that, you know, make you feel bad. You know, take your time and attention away from the things that you can be focused on, that can help you, that you can change, that can make a positive difference in your life. And so for me, as I say, I try to keep that other stuff out, not because I'm not a realist, but because it doesn't serve me and it doesn't serve most people, okay? If you know, hey, you got 2 months to live. I mean, and again, nobody knows that, okay? I'd rather not squash somebody's hope at all costs, because once that hope is gone, a lot of physiologic changes happen, okay? So I hope that helps. You know, my point is evaluate your situation, observe your situation, take things one step at a time. Don't let numbers or other people dictate your mindset or your ability or your will to live and fight and strive and dream and press on and be tough, okay? Just be tough. Hang in there. Have a great day, everybody. Have a great day. Bye-bye.